All right, this is my audience. Okay, so I want everyone in the audience to picture somebody with ADHD. It's attention deficit hyperactivity disorder. Picture somebody in your head. I'll give you a second. Okay, so statistically, most people would have pictured a young, hyperactive, disruptive little boy in a classroom. That's because that is the most researched demographic. Girls are often looked over when doing research for ADHD and not being treated or diagnosed properly. So today I'm here to persuade the audience to support medical research on women and girls with ADHD. This topic is so important because women present differently than men, so when we're only looking for male symptoms, we're missing a diagnosis or the correct treatment for girls. This is just a small example of the lacking representation in medical research with women in general. So today my three main topics are going to be the differences in diagnosing males and females, the effects ADHD can have going undiagnosed into adulthood, as well as the research that's being done today. So now on to my main points. The American Psychiatric Association in 2022 states that boy symptoms include hyperactivity, being loud, and being disruptive, whereas girls present much differently. Girls' symptoms include frequent daydreaming, forgetting instructions, losing school supplies, difficulties starting or finishing assignments, reading the same page repeatedly, quietly staring out the window, talking excessively with friends, high emotional sensitivity, or working extremely hard just to keep up. So now that we know that they're completely different, and we know that men are being researched much more, it's hard to catch when a girl has ADHD, and they also tend to mask their symptoms. Susan Young in BMC Psychiatry, published August 2020, states that girls tend to recognize when their behavior is socially unacceptable. As a result, girls suppress their impulsive behaviors and hide distractibility or imitate classmates to avoid standing out. Masking makes it harder for teachers, parents, and providers to diagnose them. Girls often try to avoid criticism for being forgetful or distracted because there's a pressure to meet a certain social standard that says girls should be polite, organized, and attentive, where boys don't necessarily have that social standard. The National Institute of Mental Health in 2024 says that when we recognize ADHD during childhood, there are due interventions that could improve these symptoms like academic skills, organization, emotional regulation, and daily functioning. This support may include behavioral strategies, school accommodations, therapy, parent education, and medication if needed. Earlier intervention can prevent years of struggling with no explanation. I have just discussed my first main point for why more research needs to be done on girls with ADHD. If we're able to identify symptoms earlier, we're able to diagnose and treat the symptoms sooner. The screening we currently use is geared towards male symptoms, and as I just went through the list, we know that they're completely different. So when the screening is being done on females, they're not diagnosing it. This could immensely improve the quality of life well into adulthood for girls, which brings me right into my next topic, the impact of going undiagnosed into adulthood. The same reference I used earlier by Susan Young states that women with ADHD symptoms include chronic disorganization, not for lack of trying, frequently forgetting appointments, forgetting deadlines and tasks, difficulty starting or finishing projects, feeling overwhelmed by routine responsibilities, losing items like your phone, your keys, your wallet, time blindness, emotional sensitivity, difficulty managing frustration, hyper-focusing on interesting activities while struggling with routine tasks, and mental exhaustion from trying to keep up. Roberta Waite in Adult ADHD, published 2010, says that these symptoms take a toll on women's mental health and self-esteem. It can affect every aspect of a woman's life. With work and education, they might have a hard time meeting deadlines or staying organized. They might have a hard time prioritizing tasks or maintaining productivity despite having strong abilities. In relationships, they might struggle with forgetfulness, emotional regulation, and impulsivity. And with their self-esteem taking a hit after years of failing to meet expectations, frustration, shame, and self-deprecation can occur. These symptoms do overlap with anxiety and depression. Patricia Quinn and Manisha Madhu, in a review of ADHD in women and girls published in 2014, says that misdiagnoses are extremely common. Being put on an antidepressant might improve your mood, but it's not going to improve the symptoms of ADHD. It may overlap with depression after years of stress, academic difficulties, relationship struggles, or feeling unable to meet others' expectations. Depression might occur. However, when you're diagnosed with depression and medicated for depression, you're only treating one aspect, not the root cause of the depression. So I've just discussed my second main point. Women are constantly fighting an uphill battle with themselves and how they are perceived. Even seeking help from a provider, women are being ignored or misdiagnosed, leaving them to feel unmotivated and helpless, which leads me into my next point. More research can improve diagnoses and treatment for girls. The American Academy of Pediatrics says that if we do start improving our research, this will help providers and teachers recognize symptoms earlier and reduce misdiagnoses and help us develop treatment approaches that better reflect females. Quinn and Madhu, the same reference I used earlier, states that women are still underrepresented in ADHD studies. So right now, more men are being studied on ADHD than women. In recent years, there has been an increase on studies in girls. However, it is still lacking. So now that I've gone over the differences between girls' symptoms and boys' symptoms, the effect it can have into adulthood, I'm now going to tell you a little bit about the research that's currently being done to date. So Daniela Ito and Elizabeth Kleine in Misdiagnosis, published 2021, and that's spelled M-I-S-S, I just thought that was cute. The research that's currently being done is how symptoms change from childhood to adulthood, why girls develop coping strategies to hide these symptoms, so the masking I was talking about earlier, how ADHD interacts with anxiety and depression and emotional regulation, whether hormonal changes affect these symptoms, so like menstruation, pregnancy, menopause, improving the screening tools, because as I mentioned before, the tools are currently geared towards boys, so we're having a harder time diagnosing girls. Whether men and women react differently to medications and treatments. And recent studies have shown possible sex differences in medication responses, side effects, and treatment outcomes. This resource specifically said we need more studies. So I have just discussed my third main point. While research is increasing, males are still taking priority in the studies. Women are not only being misdiagnosed or ignored, they are also being mistreated. In conclusion, we need to acknowledge and educate ourselves and advocate for women's medical research. I went over difficulty diagnosing and why, how this affects women well into adulthood, and what research is being done today and why it would be beneficial to increase that. I'm currently 23. I was diagnosed with depression at 17 and medicated for it, and I continued to feel confused why I wasn't improving. I felt like all my life I was told that I was lazy or that I wasn't as smart, and I always struggled with things that others had no problem with, and I never understood why. And then when I turned 18, I was diagnosed with ADHD. While I still feel like I'm not properly medicated, I do feel like the diagnosis itself helped me, A, to not be as hard on myself and be as self-deprecating, and to B, understand when ADHD is affecting me and try to overcome that instead of just ignoring it and doing what I want to do instead of the tasks I need to get done. So I urge you all to donate any amount to medical research. The donation page for the Duke Center for Girls and Women with ADHD is found on their website. It specifically states that donations support research aimed for improving diagnosis and treatment geared towards girls. Thank you.